Okay, so look, our next speaker is a senior research fellow at the Centre of Public Health and Community Care in the University of Hertfordshire. Dr. Louca-Mai Brady is a researcher, advisor and facilitator. She's worked for many, many years in the field of children and young people's involvement. Achievements include, most recently, a book publication on young people's participation in healthcare. Look, Louca will talk to us today about the practical issues she's encountered in terms of developing inclusive approaches to involved marginalised children and young people, the lesser heard voices in research. So, big warm welcome, please.
Thank you. And yeah, it follows on quite nicely from what Emma was talking about. So what I'm going to focus on now is what's different about involving young people, because obviously a lot of the principles and practice for good practice for public involvement are the same. And we were having lots of conversations at lunchtime about, how many overlaps there are and how, as Emma was saying, there's so much interest in public involvement and there's a lot of publications coming out of it at the moment. But I know myself, when I'm asked to review journal articles around young people's involvement, how often that's done in quite a cursory way. And I think what we're lacking still in this field is a bit of critical reflection. But I think also I wanted to pick up on some of the things that were discussed this morning. So obviously my interests are around young people's involvement in health and care research, but also very much in their involvement in the design, the delivery, the evaluation of services. And I know that's been picked up a little bit in some of the presentations this morning. But also, I think, to pick up also some of the discussions around gender and how services and treatments and research needs to be different when focusing on women as opposed to men. And I think also it's worth bearing in mind that we need to think about how things need to be different for young people in the context of service delivery as well. So I think just to very briefly, I think a lot of the why stuff has already been covered by Emma, but I think it's just really thinking about what's different about young people. And I think one of the things, I think when Emma was talking about the increasing amount of evidence there is around public involvement, there's also increasing interest and evidence around young people's involvement, but much less. And I think as, in research, as in health and social care services, I think young people have quite often been the poor relation in terms of service delivery and research. And the evidence base is small. It's growing, but it's small. And there's starting to be more recognition, mainly because people like me have been wittering on about it for quite a long time now, that you need to think about involving people differently. And I think Andy will talk about this a bit in terms of the co-production and some of the things about when you're doing peer research and co-production, how you have to address the power dynamics. But obviously when you're doing research with young people, there's another power dynamic as well as you being the professional and then being the service user. There's also the dynamic of you being an adult and them being a child. So we need to think about how to do this well, but there is growing evidence that it does improve research, services, policy, practice, and also that there are benefits, or there certainly should be benefits to involving young people as well. And the benefits of research, again, a lot of these kind of echo what Emma was talking about, so I'm not going to reiterate those, but I think it's really important to think about young people as well as adults in this context. But I think as well as the impact argument, how it makes it better, I think again, picking up on some of the other things that have been discussed, I think there's also an argument about rights, and quite often those of us who work in public involvement, sell it as it'll make research better, it'll make services better, it has all these wonderful benefits. But there's also another argument that actually it's not just about impact and benefits, it's about people have a right to be involved. And with young children and young people, obviously we're talking about the UN Convention on the Rights of the Child, and particularly the right to have a say in matters that affect them, and their right to good quality healthcare and information to help them stay healthy. And the articles themselves, kind of hard to dispute really, they're fairly generic, but every so often the UN Committee on the Rights of the Child issue what are called general comments, where they specify what signatories to the convention are expected to do, and they're assessed against this every few years. And so about 10 years ago, they introduced a general comment about Article 24, which is the right to healthcare and health information. And in that, they explicitly link this to Article 12 about the right of young people to have a say. And that includes what services are needed, how and when they're provided, how to assess the quality of those services. So looking at evaluation and evidence to inform service development and treatment. So, and also how to encourage and strengthen their capacity to be involved in this as well. So I think that's really important to bear in mind. But I think particularly with young people, there's a real tension between participation, provision and protection rights. And I think this really comes to the fore when you're talking about drug research, where you're quite often, young people might be marginalised, living in difficult circumstances. There's all kinds of things going on. And I think one of the things I come across a lot in my work is, this is a really sensitive topic. These are really vulnerable young people. We need to be really careful about how to involve them. And absolutely we do, and it's really important that involvement is done appropriately and meaningfully and ethically. But I see too many examples where young people are denied an opportunity to be involved and denied a voice because people are so worried about protecting them. So I think there is that sort of consideration to bear in mind as well. And while there is lots of really good practice and some really great work going on, it's really patchy. And it's not shared enough as well. I find there's all these amazing examples of work that happens, and it's not shared very well. It's not written up. And when it is written up, we talk about academic articles. There's an awful lot of academic articles about the importance of listening to young people, where young people's voices aren't included in any way. They're not co-authors, they're not quoted. It's lots of adults talking about how great it is to listen to young people. And obviously I'm very aware that I'm standing up as an adult talking to all of you without a young person next to me as well. And that also doesn't feel comfortable. But it's difficult when you're talking about events like this, which are held during school time. And I think that's another thing to think about as well. So, just to kind of briefly sort of highlight a few examples from some of the work that I and others have done around the practicalities of how to involve young people. So Andy's going to talk a little bit more about the peer research in a minute, so I won't go into that in detail. But one of the things I will share at the end is some guidelines I recently developed for Barnardo's, which is guidelines and a toolkit on training and supporting peer researchers. And that was commissioned by Barnardo's as a way to enable young people who use their services to do their own research on things that matter to them. So I think that's a really important way to do it, because a lot of public involvement still tends to be adults coming along and saying, actually, we're doing this project, can you just tell us what you think about this information sheet, or can you, give us a few things that we can include in our project proposal. So I think it's really important to kind of think about the whole range of involvement. But it can range from consultation, so that obviously, can range from kind of one-off meetings to kind of, ongoing involvement. You can have, there's a whole network of young people's advisory groups. So in the UK, we have the Generation R network of young people's advisory groups across the country. And I facilitate one in Hertfordshire. And quite often they're generic groups of young people who, get involved in a wide range of projects. But you can also have young people's groups that are where they have specific lived experience, or they're related to a specific institution or organisation. So young advisors might be where you have young people involved as part of the project team, so managing the project, advising and supporting the project on an ongoing basis. And priority setting partnerships are another really interesting example where young people or adults are involved in working with professionals to decide what the priorities should be for research, what should be commissioned. And the McPinn Foundation in England did a really interesting one a couple of years ago on young people's mental health services. So I think that's another really useful approach to consider. And this is a young people's group that I work with at Moorfields Eye Hospital. So they're all young people who have eye and vision conditions or have been involved in clinical trials. And the group was run according to co-production principles. This was at my last role at University College London. And we got some funding to co-produce an evaluation of the group. So 5 of the young group members and I worked together as an evaluation team. And so we basically wanted to find out what difference the group made. And the young people were involved throughout, both in designing the research and in the data collection, analysis and reporting. And I've just been involved in trying to co-author an academic journal article on this work with them as well, which has been an interesting exercise in terms of trying to work participatively and collaboratively within the confines of what's required for academic articles. But I think in terms of what came out of that that's relevant to this group, I think the social benefits were really, really key. Having a chance to meet other people with similar experiences or interests, having a chance to get to know each other and have fun. And that's really important too, not to just focus on, okay, what are the benefits for the research? But also, you know, developing skills, confidence, all of those things are really important as well. But also impact is such a big factor, I think, for all the young people I've worked with over the years. They want to know that their involvement is making a difference to research, to policy, to services. And I make it a precondition now with researchers that we work with that, you know, they have to commit to coming back and feeding back about how working with young people has improved and informed their research. And also involving people not just on a one-off basis. I think quite often, people come because they have to tick the box, you know, the funding application box or the ethics committee box to say they've done some public involvement. But actually embedding it throughout makes so much difference. But also, I mean, obviously I would say this because I facilitate involvement, but it does make a difference when you have involvement that is well facilitated and it is properly resourced and supported. And the interesting thing with, I think, the group we've just set up in Hertfordshire, we're actually alternating online and in person, because I think there are advantages to both. I think online's more convenient, but you do miss out on a lot of the social, informal, you know, group bonding type stuff that happens. And online's more accessible for some adults as young people and less for others. And the other one I wanted to highlight was, this is a research study I was involved in a few years ago, where they were taking an intervention that had been developed in adult alcohol services and adapting it for young people. And my role was to support young people's involvement in this clinical trial. And so we had a range of young people involved in that, but I think, and also they all had lived experience of using drug services. And the interesting thing for that is we started off with, we'll just set up a project advisory group because that's, you know, what we had to do. And also the limitations of the study meant that I wasn't allowed to start doing any involvement until we'd already got ethics approval and the study was about to start. And essentially it just didn't work. And so we've got this lovely paper we've written with this nice model of how to do inclusive involvement for young people in drug research. But essentially the model evolved out of the fact that the traditional, quite restricted model of we'd come to a meeting in a university and, you know, having a group that we trained and supported to work throughout the project didn't work. We had meetings, some young people came once, some came a few times, some we went out to existing services and worked with them. But actually the two young people we worked with throughout the study, one came to a couple of meetings, but one of them didn't, partly geography, partly life circumstances. And all of the work with her was done one-to-one, you know, meeting in like coffee shops or McDonald's or doing stuff over the phone. And this is going to be shared as a PDF, so don't worry about trying to read all the tiny writing. But this was a conference poster that we developed with the young people about the learning that came out of this project about how to involve young people. And just, you know, a couple of quotes to highlight as well, I think, which link back to what I was saying earlier on about the importance of not denying young people a voice. The young people in the project were really clear that their involvement had made a huge difference to them because they were able to use really difficult experiences to improve things for others, and that was a huge motivation for them to be involved. But also this working in quite an organic and young person-centred way was really helpful, I think, both for the young people and for the researchers. And so briefly, the model that kind of emerged from, you know, our kind of trial and error approach was having a kind of core group of like series of meetings that young people kind of dipped in and out of, but also I think working in partnership with services. So again, picking up on what Emma was saying about, you know, working with communities. I think we really struggled to recruit people to get involved in the project to start with. And what made the difference was working with services who had established links with the young people and saw the opportunity for them to be involved and encouraged them, and in some cases actually physically went around to their houses, you know, came on the train with them to meetings, and the young people asked them to stay because they felt more comfortable having a trusted adult there. So working in partnership with services who had links with the young people was absolutely critical. And I think if we'd been able to involve young people in the planning of the involvement from the start, it would have made a huge difference. And yeah, picking up on what I said about ongoing involvement, it was about, they don't need to be, sometimes with co-production there's this idea that everybody is involved in everything all the way through. But actually that's just not, everybody's as interested in our projects or our research as we are. And also life doesn't always work like that. So it's about providing opportunities, but not obligation. And I think this also links to kind of, you know, some of the wider debates about inclusion and public involvement. And just to pick up very briefly on a couple of other things as well. So this was, because I know adverse childhood experiences has been mentioned a few times. So this was a workshop we did at University College London to inform a systematic review. So we had a group of young people who all had lived experience of adverse childhood experiences, again supported by a voluntary sector organisation, coming to a workshop to look at making sure this systematic review was looking at the things that mattered to young people. And the blog posts in the references kind of talks quite a lot about some of the challenges that came out of that workshop about actually doing that. But I think it was really useful, and using things like flip charts and post-its was a really good way to kind of start the discussion anonymously and then kind of move it forward. And this is an example of a similar thing we did again with UCL last year, but this was online. And this was looking at online eating disorder content and how young people contribute to that and are affected by that. And again, we used, in this case, a Google Jamboard to do a similar thing. But I think really just to kind of finish up with some kind of key ideas, just to summarise what I've been talking about being flexible, being sensitive to individual circumstances. There's sometimes an idea that all young people can, you know, we can do stuff online because all young people are online all the time. But with the drug and alcohol project, we found that really wasn't the case. I think in that project, a lot of young people were estranged from their families, living independently. Sort of 16, 17-year-olds were living in hostels and other temporary accommodation. Quite often their internet access was limited to their mobile phone and how much credit they had. So some of them, we were posting stuff out to them with SAEs and getting them to post it back to us, or, you know, giving them phone credit. So it's about working with them, but also not saying, okay, well, this isn't working, let's find some other young people. Actually, but more, this isn't working, let's try something different. And, you know, as we said, giving them the opportunity to be involved as and when it works for them. But also, I think those of you who know the public involvement field will be aware of Peter Beresford's work. He's written an awful lot about this kind of thing. And he talks really eloquently about people also having a right not to be involved. And I think that's really important too. Again, with this project, the drug and alcohol project, we had young people who just kind of came to one meeting and then just disappeared. And, you know, we tried contacting them a few times, no response. We tried sending out, you know, questionnaires and essays saying, can you just give us a little bit of feedback on why you don't want to be involved anymore? And obviously they didn't. And that's fine. I think it's like I said, sometimes you have to kind of realise that actually people have got other stuff going on. So we need to strive to be inclusive in the work that we do. But you also have to know when to back off. And I think that's quite important as well. So just a couple of references. I realised this morning that the guidelines and toolkit on young people-led research isn't on there, so I'll circulate that afterwards. But and also a few bits of other information that might be useful as well. So I mentioned the Generation R network. There's also YPAGnet, which is a European network of young people's advisory groups, and they have a toolkit that we were involved in developing a couple of years ago about how to set up a young people's group. So, thank you.
So, sincere thanks to Louca. I think you've shared with us over a decade of research there in terms of the practical applications, in terms of looking at design and engagement of young people in services and service delivery consideration.